Californians have made extraordinary sacrifices to help slow the spread of COVID-19, and help is on the way as the state continues its rollout of safe and effective COVID-19 vaccine. Sierra Health Foundation and the center wants to help end the pandemic and provide the answers to common questions we all have about the vaccine. Kai-Ying Hang is Senior Vice President, Programs and Partnerships with Sierra Health Foundation and the center. Welcome to the show.
Good morning. Thank you for having me.
Talk about first the pace of vaccinations. I know it seemed to get off to a really slow start.
Yes, we all know the vaccine distribution is a top priority for the state. I want to thank all of California's healthcare providers who've done an incredible job thus far in vaccinating hundreds of thousands of Californians, but we know we've got some work yet to do. The state, the counties, and communities are moving quickly and deliberately to ensure that every Californian, and particularly those who are at high risk, get their shots as fast as possible.
Is there anything that's being done to kind of speed up the amount of inoculations happening? I feel like we've been picking up momentum this past week.
That's right, Aubrey, we have. I think it's important to know that everyone is working around the clock to make sure that Californians have the information they need to understand vaccinations and what support counties and healthcare providers need to speed up getting vaccines distributed. State and local elected officials have been engaged in conversations with other healthcare providers, business, labor leaders, and community groups aggressively and equitably accelerate the pace of vaccinations. New partnerships with healthcare segments will help us with more vaccinators ready to vaccinate more Californians. As you all may know, the National Guards are here and ready to help administer vaccines in California. Other partnerships are being played out, like the Walgreens and CVS vaccination pharmacy programs. So we're really excited and optimistic about this. And when additional supplies arrive in the state, we can move faster and more efficiently to get everyone vaccinated according to the phase plan. And would encourage your listeners to check out the website, vaccinateall58.com for more information.
Well, it's definitely a huge community effort. So when and how will people know it's their turn to get the vaccine?
Yeah, well, California has a new tool to help people know when they're eligible to receive the vaccine. The My Turn website allows people to sign up to be notified when it is their turn. And that website is myturn.ca.gov. The state's priority is to continue vaccinating healthcare workers and residents in long-term care settings so we can move to other priority groups and ultimately everyone once the vaccine supply is available. So encourage you all to check out myturn.ca.gov to know when it is your turn to get vaccinated.
So Kai-Ying, what if someone doesn't have a primary physician? How can they still get the vaccine?
Yeah, people without a primary care physician should contact their local community health centers, oftentimes known as the FQHCs in their community. These are federally qualified health center, or they can simply just call their local public health departments to know when and where they could go for their vaccines.
And is there going to be a charge to receive the vaccine? That's probably something that a lot of people want to know.
Yeah, good question. The vaccine costs nothing. It is free for all Californians.
That's great. Now, another thing that I'm sure a lot of people are trying to do is find a way to get to the front of the line. What can you say about that?
Well, I think it's important to remember that we all must work together and wait our turn to receive the vaccine. Our healthcare workers and long-term care residents are first, followed by people in a wide range of healthcare settings who would be helping to inoculate the rest of us. So once that happens, we can begin to move more quicker.
Is there any
quickly?
Hey, we're trying to get it done as quick as possible. I know that you guys are working hard.
That's right.
So when do you guys project the majority of Californians will be able to start getting the vaccine?
Yeah, California has a phased approach to vaccination that is well underway with our healthcare workers and long-term residents who are receiving the vaccine right now. After that, we move into the next priority group to get more vaccines out, but we have to remember that the state's weekly supplies are extremely limited at this time. So once the vaccines are produced at scale by the manufacturers and made available to the state, then we will know when everyone can have the vaccines according to the prioritized group. In the meantime, another plug for vaccinateall58.com to learn more about the prioritization of groups for
Well,
receiving
we're
vaccines.
not there yet. And when it comes to how they're ordering the groups for vaccination, I know we kind of started with the elderly population, obviously the first responders. So is that how they're breaking it up kind of by age and risk factors?
That's right, Aubrey. It is definitely the first phase covers healthcare workers and long-term care residents. We are now underway in terms of making eligible individuals who are 65 and plus in education and childcare workers, emergency services, and food and agricultural workers. And so we're going to, prioritize future groups based on age and by risk. The eligibility standards will move into unison all across 58 counties. This will allow the state to scale capacity up while also ensuring that vaccines goes to disproportionately impacted communities throughout the state.
All right. Well, it sounds like we have a positive outlook there. I'm going to tell our viewers you can get more details and about the vaccine eligibility at covid19.ca.gov/vaccines.
This interview involves commercial content. The products and services featured appear as paid advertising.